Hello, and welcome to the first webinar of Healthcare and Care through Distance Planning Solutions and our new webinar series called Technology Use for COVID-19 Response. My name is Niklas Forsling. I work for Center for Rural Medicine, R&D unit connected to Region Västerbotten.
Yes, welcome. My name is Bengt Andersson and I work at the Nordic Welfare Center as a senior advisor in the area of welfare technology. And we also have Lisbeth Kjellberg from Bornholm with us. Lisbeth.
Yes, good morning. My name is Lisbeth Kjellberg and I have an advisory company here in Denmark supporting digital transformation and telemedicine implementation.
Yeah, we will start sharing the screen here.
Very good. Yes, healthcare and care through distance planning solutions is a priority project part of the Swedish presidency program of Nordic Council of Ministers from 2018. We should say that this webinar sessions are done in collaboration with Northern Peripheral and Arctic program. You know our names already, so I just continue here. This is also part of a project connected to Interreg Northern Periphery called Tech Zones and Northern Periphery and Arctic Program's COVID-19 response group. The project that we are connected to are implemented under the lead of Professor John Condal at Ulster University. First, a few words about our organization. My organization, where I'm based, my organization has their main office in Storuman in Västerbotten. We are an R&D unit forming part of the local healthcare and primary care district of South Lapland within Region Västerbotten. We have around 15 employees, main office, Storuman as mentioned, and we're funded mainly through projects. Our main focus is good quality local healthcare in rural and remote areas connected to the primary care reform that are currently being implemented in Sweden. But we have a specific strands also of responsibility of some health. We work a lot with education, have different type of training packages connected to remote rural medicine and also recruitment. So Bengt.
Yeah. As I said, I work at the Nordic Welfare Center, and in fact, we are at the Nordic Welfare Center right now in the middle of Stockholm doing this webinar in our little studio here. I just want to add that if you think it's really strange that we are so close, me and Niklas. I have had COVID-19 and I have antibodies, so you're safe, Niklas, I think. We are both in good health as well, so it's no problem in that way. Nordic Welfare Center is an institution under the Nordic Council of Ministers. We have four areas that we're working. It's public health, disability issues, integration, and also policy, welfare policies, where the area of welfare technology, where I work, but you could also say digital transformation in public sector is the main focus of this, where distance planning solutions in health and care are crucial.
Okay, so this was our starting point when we started this collaboration back in 2018. As you all know, working and coming from the Northern Periphery and Arctic area, and also other people listening here, large part of the Nordic countries are vulnerable. Many of the municipalities are having a vulnerability index that are above 19.5%, which meaning that 19.5% of the population is plus 65 years old. So all in all, 70% of the municipalities in the Nordics are above that level. I know from my region, from South Lapland primary care district, where we are based with Center for Rural Medicine, we're around 30 to 35% plus that are plus 65. So vulnerability was the key that actually got us together to work with this, because we see the demographic challenge as the main issue. But what happened during the years was that all of a sudden we all became hit by a pandemic situation. And this situation has actually caused us to think, well, distance learning solutions may be a part of the complete solution that are necessary in order to fight COVID-19 and give a proper response to COVID-19 for a long period to come. So we continue. I'm going to speak a little bit about the project that we are, and Bengt are going to introduce a few of the coming workshops that are coming. So the current project that we work with consists of 3 main blocks. Today, we're going to discuss about the block 1, mapping of distance learning solutions in the Nordics. What we've done is a complete mapping of all distance learning solutions back in 2019. We published a publication in September, and what we should say about these solutions is that these solutions are no pilots, no projects. It's all implemented services accessible for the population at the local and regional level. And then the second block is about mapping methods and tools for implementation support. And this is our next seminar that are coming on November 3rd, between 13 to 14:30 CET. So you're welcome to log in for our next seminar at that point in time. And we're going to also have registration for that seminar. So don't be scared, just join. But Ben, could you give us a couple of words about, maybe I should say that the specific contribution that we're giving towards COVID-19 response group on the second webinar is the question, how can technology be brought to the people who need it or don't know how to use it? But a small teaser, Bengt, what are we going to speak about next time?
Yeah, we have been mapping all national visions and strategies and also tools for eHealth and welfare technology in all five countries. And what we've seen there, that there are national visions, there are national strategies, but we lack of tools, national tools. We can see that there are tools for how to implement distance learning solutions in a municipal responsibility in both Denmark and Norway, but not on the regional level when it comes to health sector. We lack of that. What we have identified as the most, the absolutely best method of doing this is what they've been working in Norway during the years, eight last years, and they have this roadmap for service innovation, Veikart for tjenestinnovation in Danish, and we have translated this to Swedish. We also translated it to English, and we will also translate it to Danish, Icelandic, and Finnish before Christmas. So it will come during the autumn, winter here. We will come with the translations, and this is the most sophisticated roadmap we have seen tool to implement distance learning solutions.
So the next webinar will be focusing on this tool, how to actually make the services accessible for the population, and sometimes for the population that are not used to use distance learning solutions. So the third block that we have worked with in our project is through calls identify municipalities and regions that want to implement distance learning solutions. And experience from this, we have one joining us today. Lisbeth will speak about one case, but the third webinar that will be on November 18th between 1 o'clock to 14:30 CET will focus on the experience from this implementation. And the question that we connect to is how can we fast track innovation? So on that webinar, we will get the experience from 52 different municipalities that have implemented their services and 8 different healthcare regions that have been supported. And they have all applied this roadmap for service innovation, which you will be further introduced on the second webinar. And the teaser is that they all cheat. They all go to phase 3, which is where you start elaborating on the service model, and phase 4 about technology. They don't do their homework when it comes to anchoring and insight. But more about that next at the third webinar on the 18th of November. And the fourth webinar will be on wearables and response services. This will be on December 14 between 1 to 2:30 in the afternoon and CET time. What we have seen here is that many of the different type of wearables that we all walk with today, they are all having the different services that we have mapped out in different format, connected into the or provided through the rest of your where your wearable is based. So, but we see also a challenge here when we start collecting data, that we can't use all the data that we are collecting. We need a kind of sophisticated response service system. So that's more of an innovation track that we're going to apply on the fall seminar, which will be very interesting. So this was the first session, and we have said that we're going to have the opportunity to see if there are any questions so far. Questions can be submitted into the Q&A function that you have on top of your screen, or wherever it's based on your screen. Yeah. In our case, it's based on the top of the screen. So you can be anonymous and submit your questions. And if you don't have any questions at this point, then you could always submit it later. And we will try to select some of the questions that you are submitting. So we have one here, and that's about how long will this collaboration continue, and are there more calls for regions and municipalities to implement solutions? And we have what we know is that we're going to continue with this project that we have now up to June 2021.
Yes.
But Bengt.
Yeah, there is also right now we're in one of 13 activities in the action plan for Nordic for the Nordic Council of Ministers for reaching the goals of 2030. So hopefully we will be able to continue for 4 more years with this collaboration and this project. But there will be decision made in the Nordic Council, not the Nordic Council of Ministers, in the Nordic Council in late October here, and that's the final decisions we'll be making. Then we can come back with more information. So in the upcoming webinars, we could tell you a little bit more about our plans for the next 4 years.
Mm-hmm. So there is also a question if there will be more calls for regional municipalities, not within this time period that we have now up to June 2021, yep, but for the next period we're planning for a couple of calls. So stay tuned. Feel free to submit questions whenever you want. So that's the first part of our introduction here. And I think we continue. Yeah. Bengt, I think you should go. Why isn't this now? Yeah, good.
Yes, mapping of distance spanning solutions, block 1. Yes, with the eHealth solutions already exists, and what should we put in place for the technology and with the lowest stress of that's what we're going to try to explain. It's a couple of services here. And as Niklas said, we have done a publication of this. It came in Swedish in September 2019, and in January, I think, 2020 this year, it came in English, so you can download it. This presentation or these links will be available for you. You could also go into www.vopd.nu or healthcareatdistance.com to download these publications. What we've done in these publications, we have categorized these services in 4 different categories: remote treatment, remote monitoring, remote meetings, and the 4th one with new digital services that didn't fit in the first 3 ones. So there are 24 solutions presented in this publication, but we have also, wow, how many is it? 19 more or something like that on the website. So go in and check on the website as well. And the first one, it's you, Niklas.
Oh, it's a me. Yeah. Did I start? I thought it was you. Sorry. Virtual health rooms. This is one solution that are used for distant monitoring and distant treatment. This is a solution developed by our unit, Center for Rural Medicine, together with the region Västerbotten. And this is a way of actually moving the healthcare services closer to the population. So with a distance of approximately 50 kilometers to nearest primary care center, we have what we call a virtual health room. And in that room, you can go in and do self-monitoring and self-treatment activities. And That room is a way of for the population to have more frequent accessibility to healthcare services and do monitoring and self-care when it fits them and when they need it. Of course, the rooms are equipped also with distance meeting opportunities, so you could schedule your healthcare meeting with healthcare staff from primary care centers and also other institutions within our healthcare services. So, sorry, I go the wrong way here. So that's the service that we have 8 of them in our county. And we think that this is a good way of providing the future healthcare services and give a hint to the population how the future would look like. But the main purpose of this was at start to see how much can actually the population do themselves, which we hadn't explored it. So this is a way of actually providing the opportunity for self-service when it comes to healthcare. Yes, the next one is also me that I'm going to present. This is a research project coming out of Aalborg University, VOPD. They developed what is called a telekit solution. This was one of the early solutions developed when it comes to dealing with COPD and other chronic diseases through distance managed solutions. What we've seen with this one is that it has been very well accepted by the COPD patient groups. And they feel that this is a way for them to cope with their diagnosis in a much better way, and that they can do more frequent monitoring and care treatments when it fits them better. Sorry about that. So it has been very well, very thoroughly evaluated, and this has actually demonstrated the success of the use of this. So 71% of the citizens experience a much greater security when using telemedicine, and 26 experience a high degree of freedom. And as you know, that work with healthcare, these are numbers that are saving costs at the longer run. People feel more safe and secure when being able to monitor themselves from their own homes. And the last one that I also will introduce to you is Helsevera. Helsevera is a national health portal for the citizens in Iceland. Helsevera has approximately, it's for all type of health services connected to this portal. And this is fairly new. I think it's like 3 years old, 4 years old. And it's continuously being developed. For more and more services are being added to this.
You go.
Okay. So there we are. We're back in business. So this health portal has been in use for 3-4 years, and now I need to continue here.
Yeah, sorry, I just want to check.
So the effects have been very successful. They are very well appreciated by the population, and we can see e-prescriptions in this dispense medication, and all the different healthcare meetings you have been at any hospital or any primary care center. But interesting enough also is the last line here, that you could actually enter your own measurements into the system, which is then leading to that you could actually have use your wearable and the functions on your wearable and feed in the vital signs from continuing measurements being done all day, all year into the system if you wish to. So that was the the final one that I had, Bengt.
Yeah, this is connected also to healthcare, of course. This is it's a Danish platform infrastructure. It's called FUT in Danish, Fælles Udbud og Udvikling af Telemedicin. And this is something that's been going on for a couple of years. This collaboration is between the Danish state with the authorities. It's also with the 5 regions and the 98 municipalities that have come together and doing this together and had developed this platform and this infrastructure. We think this is very interesting to see that they are doing this, because the goal is that the services, the companies that has these services could connect their services into this platform, but also for the citizens, also for their health record system to connect, and also for municipalities from their services to connect to this platform. So independent of healthcare and care, you could use this platform when it comes to using telemedicine or distance spanning solutions or other digital solutions. This started up they have started up this year, and the first service that they connect into this system is the COPD service that Niklas presented just a couple of minutes ago from Denmark. So we haven't followed the development, the latest development of this, but this is really interesting out from a national perspective to see that you could do this connection and build this further. And they are going to go on with other solutions. I think it's the upcoming ones is for cardiology and also for people with diabetes, telemedicine and monitoring services for these groups. Yeah.
So we should say that from our experience and the research that we have done, this is the only system we can see where you take it from all the way from national ministry level through all healthcare regions, all 5 healthcare regions in one country and all 98 municipalities in one country, that you are through a platform providing all the population, the entire population, with self-monitoring and self-treatment opportunities for patients with different chronic diseases.
Yeah. It also meant that the citizens themselves could connect up to with if they have services similar to what you explained with Helsovera on Iceland.
Exactly. So what you see, but we have given examples from healthcare sector is first that you can move it closer to people's own homes with the service that we have with virtual health rooms in my healthcare region. But you can also through the COPD telekit solution and through this platform move into people's own homes. And by combining this with the solution that they have on Iceland, you could also do self-monitoring and use other type of self-monitoring vital signs that you measure and feed it into the healthcare record. Mm-hmm. So I think that's the first part, and then you are going to speak about the municipalities.
Yeah. Yes, I'm going to give you some example of what we presented in this publication with 24 examples, and I just want to start with say that overall, from our perspective, we could see that distance spanning solutions on municipal level, in sort of social sector, care sector, in the municipal level, have come a little bit further than the healthcare telemedicine or eHealth. We hear a lot about eHealth and telemedicine in healthcare sector, but what we see, there are a lot of sort of pilot projects going on. When we go down to the municipalities and see what they have been doing in the last 10 years, we can see that they have for sure started to do this implementation and digital transformation in all Nordic countries. But as we mentioned, for example, Norway, they've had this program for welfare technology since 2013. And of course, that have had an impact for them to come further in this area, to see that they have done this. We see that there's at least half of the municipalities in Norway that had implemented 8 services that they were aimed to implement by 2020. But again, you will hear more about this on our second webinar. The first technology, the first service that we would like to present is the location technology, this GPS watch. We have a lot of safety alarms around for people, mostly for vulnerable elderly people to have in their homes, but they work only in their home. If they want to have a safety alarm that works outside, they need to have this location technology, safety, mobile safety alarm, so to speak. And the technology here differs from different services, but they all have a GPS in, and you could in collaboration, of course, with the patient, with the citizens, do geofencing, or how you do when you connect people. What this service does is that make it possible for people that maybe have cognition problems, dementia, to dare to move around and to walk outside and not be afraid of getting lost. And a statement from one of the citizens in Norway that had this service for a long time says, "A day without a walk is a bad day." It's a quite simple statement, but I think it says everything. So this is very good for the citizens. We know that this is a very appreciated service, but it also have economical consequences, effects, doesn't it, Niklas?
Yeah, since I started business economy,
you like your economy.
Bengt asked me to speak about this, but they have actually done studies on this, and they have actually looked into this quite thoroughly. And the interesting part here is that they see a lot of savings by investing in this type of technology. So approximately 124,000 Norwegian crowns per year are saved per user. And this is connected not to reduction of staff or anything of that kind. It's all connected to that the patients, their level of the healthcare level are maintained at a higher degree of vitality for a longer period of time when they can move around more freely. So the 124,000 Norwegian crowns are only connected to that the patients are feeling better and more vital, and do not need the intense care services that are around the corner for these patients that often are dementia patients. Of course, you can also add to this search and rescue action activities that are often frequent happening for people with dementia, but that is not part of this calculation. And if you would take that into the calculation, the number would be much higher than the 124,000 Norwegian crowns per user. I took the liberty to calculate what would this mean on a Swedish level if we would have the same ratio as they have of user as a Hevendram municipality. That would mean that we're having approximately savings in Sweden to make that equals 500 million Swedish crowns, approximately 50 million euros per year.
Okay, I go further with the next service, that is digital monitoring with the cameras. This is something I've been working in this area for quite a long time. And I remember when this came up, it's like 11 years ago. This was really something that, oh, could you really have a camera in your bedroom? But this is a service that is highly appreciated. In fact, we know that in these municipalities that offer these services, the demand is often higher than what the organization can offer. The thing is that we have a lot of people that's vulnerable that need to be looked after during nighttime. The people that works these night patrols, they start around 9 o'clock in the evening and work to 7 o'clock in the morning, and they of course help people during evening time and morning time, but during nighttime they also travel around to see if people are okay. There are studies made a couple of years ago that said that 40% of these night patrols, the activities they do, they just 40% of this just to drive around to see if people sleep good, if they are staying in the bed and sleeping. What happens when they drive around and do this is they sometimes wake up the patients instead of so there are an insecurity that it come in people into your home and into your house during nighttime. And this is what we better offer to do this with digital night monitoring. Of course, you do it with together with the user, agree when they will be looked after and how often. You could also with this service go into a person and see if they are right several times during a nighttime instead of just coming once. There are also solutions with sensors around in the Nordic countries when they use, but it's the same kind of service. There are also värmekamera, heat cameras, what you say? I don't know the expression in English, used for doing this. And there are of course impacts and effects of this due to economy, reduced people working nighttime, but also we can see CO2 impact with less driving. And I think there is some municipalities in Norway that offers this as the first offer. You could get the digital night monitoring via cameras as the first offer. If that doesn't suit you, they will use the sort of old physical way to do these visits during nighttime.
Yeah. So the main service that they provide is digital night surveillance, and if they need special reasons why they not should have it. And we see that more and more municipalities are going this way. We should say to any Irish and Northern Irish and Scottish listeners here that night surveillance and going out to the patients at night is part of the legislation in the Nordic countries that you need. If they have been granted that level of security from the municipality, we need to go out and look at the patients so they are not having fallen from their bed, etc. During nighttime. So this is part of the service provision for elderly care in Sweden and the Nordic countries as such.
Yeah. So the last service that I will present here is something that is a responsibility for the municipalities, but also it goes into healthcare responsibility, and it's the challenges we have with people that have one or several chronic diseases, maybe also in combination with cognition problems, how to take the right medicine at the right time. Where there have been developed during these years these electronic and automatic medicine dispensers, where you put in the medicine here and for I think 14 days, 2 weeks, and you program them to automatically come out with this little cup of medicine at the right time, with the right medicine. It's been also here we can see there is of course effect on the organization, but also that the patients, they eat their medicine at the right time, and that's very good for their medication. But we also see that these services also often are combined with forced video visits to ensure that the patient really take the medicine and put it in the mouth and take a glass of water and really swallow the medicine. So we have seen some examples of using these electronic automatic medicine dispensers that the staff are coming out anyhow. But then this combination of forced video visits and electronic and automatic medicine dispensers are a very good solution. And this is really, as we hear, sort of a rocket around the Nordic countries when it comes to having these services out. This is during the last year, this has been one of the most popular services that are implemented in the municipalities in the Nordic countries.
Yeah, but we could say that the 3 services that we recommend municipalities to start off with are GPS technology trackers for the patients, especially then patients with cognitive disabilities or cognitive challenges. And secondly, the digital night surveillance. And thirdly, this electronic medical dispenses. And the most interesting part is when you combine these services.
Yes.
So we have an example where we have been visiting them, and we have also been coming with a short publication about them. And this is a description of Exote. Exote is a joint healthcare and social service district in East Karelia in Finland. So they got together with 9 municipalities, and they all came together for the reason that they wanted to save their hospital that is based in Lappeenranta. And that hospital in Lappeenranta is still there. So they have succeeded to save the hospital. But what is interesting is that the combination of services that they are providing and the healthcare services have moved into people's own homes. So for instance, the services above that we have described, and if you take it from the social service perspective, they are using GPS trackers. They geofence the users of the GPS trackers, so they are not allowed to walk maybe 1 kilometer, longer than 1 kilometer from the house. If they walk further from the house, a car goes out and a patrol comes out and pick the person up and drive them home, so they are not getting lost. And they are, by that, as we explained, the patients are staying more vital over time, and they are not in need of greater social services so the costs are lowered a lot. Secondly, they use the medicine robots and they combine it with force camera technology. So when the person, they have a schedule and a situation room, and when the person should have their medicine, they visit the patient by knocking on their door digitally. And the patient goes to the camera or to the screen and open the door and speak to the social care worker that is behind the screen, and speak to the person and say to the person, now it's time for your medicine. And we know that the medicine dispenser has now put medicine into your cup. Please go and fetch the cup and get a glass of water so we can see that you can take the medicine. And then they make sure that the patient have taken the medicine, and then they go to the next patient. So in Exote, they have a situation room where they're from 2 seats, 4 full-time employees per day are making 90 visits per employee, 90 home visits per employee per day. And that's a lot. Compared to other services that we know, this is a great saving. I know the statistics from Storuman municipality, and distance is everything in this. We know that Storuman municipalities every day, every year, have all year round, have 15 full-time employees just sitting, driving a car, because it's so long distances to visit all the patients for night surveillance, for medication, but also for other reasons, other services that they need to provide. So we could also say, just to lean back to the services that I described about the patients with chronic diseases, they are also being offered self-monitoring opportunities in East Karelia's social healthcare district. And the hospital today that they all got together to make sure that they can save are today half empty, because most of the services are provided in people's own homes. So what we see is a clear trend that the districts, the healthcare and social care districts that have gone the furthest, they have a well-functional, integrated healthcare and social care service model, where the population don't see the difference of social services and healthcare services. And secondly, the first point of care is people's own living rooms. So the healthcare districts that have gone furthest in digitalization have already moved into people's own homes. And that is a trend because the patients want that to happen. We know this from a review that we're currently are ongoing. We have seen the first draft of the review, and patients are very keen on taking care of themselves. and being empowered by the healthcare services and social care services to take care of themselves. And this is the future of healthcare and social care service, to empower the population to make sure that they can take care of themselves. And with technology that exists today and the new technology that is coming, this is something that we all ought to do.
Yeah, I just want to add that if you take it from a COVID-19 perspective, you could also see that the groups, the target groups that we see here, also the most vulnerable target groups when it comes to the threat of getting COVID-19, people with COPD, cardiovascular problems, diabetes, and so on, and just to be very old, to solve and offer them these kind of services. Secure them out of that perspective as well.
So another thing that they do in Exoter, we can't leave this out, is that they are before they are sending all the healthcare data to the National Data Archive, which is called Kanta, they make a copy of this and they gather this into a data lake. And they use this data lake for research purposes, and they use this to get a ping. When the person have a specific vital sign that indicates that the person should have an interaction. And then they have a collaboration with the entire community of all the municipalities in Latvia, in East Karela, where the football associations and different training association, cooking clubs are providing offers for the population, so they have opportunities so they get instructions and good opportunities to stay healthy. So this is the future of healthcare as we see it. We don't expect all regions in the Nordics to develop an Exoter, but we see that regions are going to go to the direction of more integrated healthcare and social service opportunities, and it will be supported strongly by distance planning solutions, not only to address the demographic challenge, but also in this case to provide an opportunity or an option compared to the physical meeting, so we can protect the most vulnerable citizens in COVID-19 pandemic situation that we are in.
Yeah, and I think we have one question here, a very long question.
Hi, interesting presentation. I was listening to another webinar during the Swedish Innovation Week where it was said that the use of medicine robots decreased during the last year due to the fact that a lot of medicine is wasted when you change medication and you need to empty the whole robot. Do you know anything about this? I leave this to Bengt. He's more updated into the Swedish situation.
Sorry, no, I haven't. That information haven't reached me. But that's interesting information that we absolutely will look into to get more and see who done this. So I could please get back to you and hear more about that, because that's an interesting information that we got to see how do you handle this situation.
At the same time, when you're being prescribed medicine and you have collected the medicine, it's in a way wasted if you're not going to use it.
Yeah, that's not good.
So I mean, no matter if you put it into dispenser or not, it's wasted.
Yeah. So that may be why they in Finland work a lot with video, forced video cameras as well in combination. I think in Exoter, if they put a medicine dispenser there, they are also always a forced video visit.
So I think what you have here is a kind of innovation that you could actually make small packages of the medication, so you could actually reuse the medication that are put into the dispensers. Okay. So you're welcome to submit questions when you have anything that you want to ask us. I think what we are now going to do is that we're going to leave the floor to, we've come to the point where we are going to invite Lisbeth Kjellberg to the floor.
Yes.
Lisbeth has collaborated with us for a few years in different formats, but she's now going to speak about the service that she has implemented in Bornholm in Denmark. Bornholm, I should say, you will explain this further. Bornholm is an island between Sweden, the south of Sweden, and Sjælland. Sjælland, how do you say that in
Zealand.
Zealand, yeah, Zealand in Denmark. So Lisbeth, try to explain us what you have done for Bornholm.
Yes. So thank you for your presentation and introduction, Niklas and Bengt. So my name is Lisbeth Kjellberg, and I am working as a consultant, and I have my own company called Lit Consulting. And we, as I said earlier, are supporting within digital transformations, agile transformation, and also telemedicine implementation. And as Niklas said, I have been attached to the VOPD project as from the beginning. So I've been working with you, mapping out the solutions that we know is implemented today in the Nordic, and also during the calls that we have had in the project. And one of these calls, the second call, we have, I have 4 projects in Denmark, which I am advising in their implementation process. And one of them is the digital outpatient clinic at Bornholm Hospital. And if you take the next slide, please. So Bornholm is, as Niklas said, very far away from Denmark, as you can see. And it's not between Sweden and Zealand. I have to correct you there, Niklas. It's between Sweden and Poland, actually, in the center of the Baltic Sea. So as you can imagine, we have from Bornholm a lot of distance to the mainland. And it takes normally maybe around 4 hours to get to Copenhagen, or if you're lucky to get on a plane, it's a half an hour plane ride, but still it's a long way from the capital region. There's some fun facts about Bornholm, or fun, I don't know. It's approximately 600 square kilometers. The perimeter is 140 kilometers. We have, for the first time in 100 years, below 40,000 citizens on the island. So, and here you can imagine on the sparsely populated areas we are talking about here is that we have a demographic with elderly people, and the people that are here are, when they are sick, they also are multi-sickness. So it's similar picture as you see in other areas in the Nordic. Bornholm is a region municipality, and it's a part of the capital region. So as I said, you can transport yourself to Bornholm either with a ferry from Denmark or Sweden, and in the summer there's ferries to Germany and Poland, or you can fly. And the main business on the island is currently now tourism. It was before fishing and raw materials and agriculture, but it's turning more and more towards tourism. Yes, please change. During the autumn last year, the hospital and the capital region did an analysis about the possibilities of telemedical areas in the action of Bornholm. And the result, or the conclusions from this analysis, is that there's of course an increasing pressure on the overall health services at Bornholm as a result of more elderly people and citizens with a chronic disease. As I said, there's a long transport time for the individual patients or citizens to get to treatment. And on top of that, you can see that we have approximately 40,000 single travels on a yearly basis from Bornholm to the capital region to get treatments. So there's a big opportunity here to see if we can use telemedicine to lower that number of travels. And that also links into that telemedicine services will give patients easier access to specialized treatment, but also give them the flexibility and not this long travel that they use to get to the treatment that they need. And of course, you can see from data that the outpatient contact is primarily patients with cancer and chronic diseases, that they are the larger volume of these people. Yes, please change slide. So the hospital have developed a new strategy, which they call Digital Island. And I think we have been talking, Bent, Niklas and I, that a digital island can be an island as Bornholm, but it could also be an area like the southern part of Lapland that Niklas told you about, or the Exote in Finland, or other. It doesn't need to be an island, but it's the island in this case is that they are remote from the main regions. But the Digital Island 2020-24 strategy on Bornholm Hospital have 5 tracks, as you can see here. The one track is what can they do themselves at the hospital within telehealth. And here you can see the reference to the VOPD project, which is here called KOL. So what is it of telemedicine services that they are already working on and implementing? And they are getting support at the hospital from the capital region, because at the region they have knowledge sharing centers for telemedicine and health research and innovation. So this is where they, have the link to their capital region. And if you look at the health IT in Denmark, they are going to use, of course, the platforms that are already here for the electronic health records, which is called My Sundhedsportalen or My SP. And then they also looking into the digital competences. So what do we need to prepare the citizens of readiness, the clinic, the clinical staff, the organization changes and all that. And at the last point is the research that they would like to set up at the hospital to see if they can be like a network point of research within the Baltic area or in the Nordic when we're talking about digital islands. Yes, please, you can change. And here you have some of the statements that we have picked up recently, especially when the COVID-19 pandemic started earlier this year. And I have numbered the statements here. So number 1 is from a person who actually himself contacted the hospital and asked them to set up a video consultation. So instead of him spending 18 hours traveling to Copenhagen, he could have the consultation in 8 minutes. And I can tell you that this person was plus 80 years old. So, I mean, we have people here on the island who are actually ready to do this transformation into having video consultations with the specialists on the other side of the Baltics, as we say. Number 2 is a lady who has a cancer treatment, and every time she needs to go to Copenhagen to get her treatment, she needs to have her child looked after for several days, because often when they leave for a treatment or a consultation in Copenhagen, they have to leave very early in the morning and come back home very late. And number 3 is a similar thing. I mean, some of the patients need to get up 2 o'clock in the night to be ready to be picked up at 4:30 in the morning, and then go to the airport and have a flight, and then come to the hospital, stay there for maybe 3-4 hours waiting to get the consultation, which takes 15 minutes, and then they have to go all the way back again. So there's an opportunity here to use telemedicine and video consultations where it is suitable. We are of course aware of that you can't do all the consultations on video, but many can be done by video consultations. And number 5, I think, is also one of the statements that we can use, because you have people who actually have to pull out a whole working day to get to a 5-minute consultation in Copenhagen and go back again. So all these statements is just to show you that there's a willingness from the citizens and the patients and to actually make this transformation into a telemedicine solution if they can have the possibility to do so. And that's that's the big question, isn't it? So please change to the next slide. So what the hospital have now done is that instead of going, and we can just have questions about this a bit later if you want to, but what the hospital has set up now, or will offer the citizens on the island, is a digital outpatient clinic situated at the hospital. And the clinic will be ready by the end of October this year. And this is a fantastic potential and also opportunity for patients and citizens, and to give them that support, and also in what we say equality in health focus. Because as you can imagine, I mean, what are the equality in health if you're living in a sparsely populated area like an island, or away from the treatment that you can get if you're living in close to the university hospitals. So by having this digital outpatient clinic, I mean, at least we can support the patient and the citizens in their consultation with the specialists at the university hospitals. The first step in the clinic is to set up video consultations, and then from there we will see how that will develop. It is designed in a separate room at the hospital, and it is integrated in the eHR, so the electronic health record, which is called Sundhedsplatformen, to be able for the clinicians to do the patient journal here and then. And the room is equipped with other equipment like a blood pressure monitor, the scale, and EKG monitoring for heart, monitoring the monitor, and other things. The first selected area that we are going to do this transformation for is the Danish Headache Center. It's a cooperation between Rigshospitalet and Bornholm's Hospital. So we have selected a group of patients who normally travels to Copenhagen to get their consultation. And what we have done is that we have been through the workflows, so done an as is to be analysis for patients and for the clinical staff, and have now integrated the service into the existing health records. We have already done 10 video consultations, and there's a lot more being planned. And by the end of this month, as I said, the clinic will be ready and open for even other disease areas. So we are thinking about expanding the neurology area, and we're also looking into sclerosis, sleep apnea, and cardiology as potential new disease areas where we will open up this service. So the focus is to create value for all and equality in health. And it is a cooperation between the patients, the clinicians, and Bornholm in general. So also the municipalities, as we have talked about. And as you can imagine, there will probably be climate footprints or based on this, because if we can track and also collect data that actually could show that we lower the 40,000 single travels to maybe just, if we can cut down 20%, that would be fantastic. Yes, so that is the end of my presentation, and I'm happy to take any questions that you have so regarding this project.
Yes, we're on.
Oh, very good. I need to open the questions here so I can see them.
Yeah.
Yeah, I have one question for you. And I'm not sure if you can see all of them here. I need to scroll down here. I can see that there are more down here at least. I'm not sure how to scroll down.
Oh, yeah.
We have many questions here. I'll start with one for you. We saw that you had a number of next coming services that you are up to the challenge of being implemented through distance banded solutions. But what do you see as a potential for Bornholm Hospital? How many different type of service do you think that you can see in future for Bornholm Hospital to connect to different specialist care units?
I think what we can say is that there's a lot of opportunities there because of if you have a patient flow, if you are if you are having any kind of chronic disease and you have a disease flow set up for you, many of the consultations that you have in your situation is that some of them are just controls. Are you okay? Should we change your medication a little bit? And these type of consultations could be easily transformed into video consultations. And the thing is, on Bornholm, in this outpatient clinic, digital outpatient clinic, they have the patient is supported by a nurse or a doctor. So there will be someone there together with the patient to help them have this conversation with the specialist at the university hospital. Did that answer your question? So what I'm saying is that there's a lot of opportunities. And what I'm also saying is you can't just do video consultation. You do really need to have your first consultation with your clinicians, and you have to set up the scheme for your treatment. But in that process, you have to have this conversation. How many of your visits to the would you like to transform into a video consultation? We do have examples in the northern part of Denmark, in Jylland, in North Jylland, where they actually do set up as a standard that they will have the following consultations made in a video consultation, and you have to agree to come and see the clinician. So they have turned it a little bit more to the other side. Yeah.
It's very interesting. I think you mentioned here in North Jutland, we know of your North Jutland, Telecare Nord, of course, and it was very good. It was very powerful, the statements that you gave from the patients, that why should we travel a full day to get a 5-minute meeting and hear that all is well?
Yeah.
Or get my medication corrected. And we know that North Jutland has, or Telecare Nord has, they take the perspective that the patient's time are equally valuable as the clinician's time. Yeah. Meaning that you should find a solution that saves as much time for both parties.
Yeah.
And this is a mind shift, I think, that when you think of healthcare, that the healthcare provision has always been that you go to the healthcare provider. Mm-hmm. But if you think that the provider and the time of the patient are equally valuable, then you need new type of services. And Lisbeth, you have 40,000 approximately 40,000 flights every year to Zealand and Rigshospitalet, which is the main hospital in Copenhagen.
Yeah.
Give us a number. How many of these are you expecting to cut off for the next 2 years? Give us a number.
I would love to give you a number, Nicholas. I mean, and I think we should aim for cutting down 20%. But I need to come back, and I would love to come back maybe in half a year, and we can see how much have we already done when we set up this the outpatient clinic at the hospital. And if we can do more, I mean, that would be fantastic for the patient, and not at least. But it also gives an opportunity to rethink your service model, isn't it? Because what we see as one of the challenges in Bornholm is that if you first have been diagnosed with one of these diseases that requires support from Copenhagen, then you are not known by the hospital any longer. Mm-hmm. Because the service goes towards your private doctor and the university hospital, or the specific area. So you are out of the hospital data, so to say. So we need to link this again to be able to find, and that's what we are doing now, talking to Rigshospitalet and the municipality or the private doctors to see how can we identify the people or the citizens and the patients that could be offered this solution instead of the hospital are sitting waiting for an 80-year-old person coming saying, I would like to have a video consultation. We could be more proactive and say, okay, we will offer that services to everyone, and be good at this.
But I'm thinking, I mean, you have a strong case here with Bornholm Hospital, and as you're saying, explaining, when a patient are becoming a specialist under specialist attention by Rigshospitalet in Copenhagen, then they are, so to say, the responsibility is moved from Bornholm Hospital to Rigshospitalet.
Yeah.
But what type of service are lacking here? Because this 80-year-old man or patient, it could be a woman, that came to the Bornholm Hospital and said, can't you set up a video meeting for me? I mean, that's not the hospital's role. What type of services do you foresee in future so we could actually provide the new, bring the opportunities to the population? What is missing here?
I think what we could see from the COVID pandemic when it started in March was that suddenly, and I hope I'm not treading on people's toes here, but suddenly you could see that the clinicians saw the value of being able to do these video consultations with their patients instead of asking them always to come. I mean, we have been working in the same kind of structure in the way that we treat patients. We set up this patient flow for disease management, and then based on that, it has been difficult to implement the digital transformation within the clinician part of this. But now, being forced to do these video consultation, you suddenly see the willingness to change is also on the clinician side. And the integration of doing the video consultation in the electronic health record system is very important, because that gives the opportunity for the secretary to send out the invitation for the consultation. It gives the doctor the possibility to do the health record. So the integration of the video consultation is very important, that it is seamless, and you don't need to do many different places. So that has been one of the big leaps, that we have now integrated that option in the electronic health record, or in my Sundhedsportalen, as it's called in Denmark.
Yeah, the health surveyor of Denmark, Sundhedspotalen.
Yeah.
Yeah, very good. I think we had another question here. Maybe Bengt, you could answer that one.
Yep. Should just start sharing here again. Oh, sorry. This is we are further away. Long. Yes, I could start that. Get that. We had a couple of questions, in fact, that concern statistics. And how many more services we have in this area. And then you could go into healthcaredistant.com to look at the other services or look at the publications. We also had questions as how many, if there are statistics, how many people that in fact have these services around in the Nordic countries or in the nations. And we're trying to figure that out. In fact, we have here at the Nordic Center of Welfare, we have a benchmarking project going on, trying to find out, to see how many individuals that in fact have these services offered to them and using these services. And we will be able to catch the data for the people for 4 services in the municipal level, but it's quite harder to catch the data when it comes to healthcare and the region's services when it comes to that. But we're working on it. We have no real answers to that, but that's one of our prioritized area to look into, to really see how many individuals really have these services.
Yeah. So of course, that's a key question. We know that the services exist. For instance, GPS trackers or technology for location technology, as was presented. We know that 70% of the municipalities, of the 291 municipalities in Sweden, are providing that service.
Yeah.
But we know that only 1,500 people are using it.
Yeah.
So is that an implemented service? According to 70% of the municipalities, yes, there is an implemented services, but we can't see any use of that many users as it should be. So to some extent, it may be applied for a specific person where the relatives may complain that this is a challenge for them, that they have a runner that are disoriented and go out from their house and they can't find their way home. Yeah. And then they get a location tracker on them. So this is the reality, that we don't know how many users that there are of these services. And if you look at the services that I presented connected to the healthcare sector, we see that the future will be that self-monitoring and self-care opportunities for chronic patients will be the main areas where the healthcare sector will invest in. Yeah. But today we can't get a number by the different healthcare regions in the Nordics, how many users they are having of the different services. So it's still at an early phase. You have seen the solutions that we have presented. We know that these solutions are built on old technology. Innovation investments into this field are fairly low because it has been very difficult and challenging to implement these solutions. So we expect that the first step will be to use the models that exist to get solutions implemented. And then when healthcare regions and social service units at municipal levels are providing more services to a larger share of the population, we will see investments come. Yeah. Are there any final questions from anyone? Then you should submit this at this point in time.
Niklas, can I just come with a comment?
Yes, please.
I can see in one of the questions is they were asking about my name. And I haven't, I realized that I didn't put my name up in the slide. So I have written it in the chat.
And the answer section, yes, in the chat.
Yeah, can you see that? So if anyone wants to contact me, please do. Yeah, thank you.
What we will do is that we will upload this presentation and this session on healthcareatdistance.com, so you can watch it again. And we will also provide the PowerPoint slides that we have given at this session. Yeah. I think if you don't have any other questions, then we are going to round this up and give you the dates again. So we have here 4 more webinars, but the 3 ones that we are responsible for are the ones that are listed to be on the 3rd of November, next time, 13 to 14:30 CET. And that's where you are going to be informed about roadmap for service innovation.
Yep.
And that's a tool that are helping to bring the technology to the people, and also make sure that it becomes an equal service offer that makes it possible for all type of users. 18th of November is our 3rd webinar, practical examples from implementation work, a little bit what Lisbeth has hinted today.
Yep.
And more information of that kind will come 18th of November, and we will mainly answer the question that COVID-19 response group has outlined: how can we fast track innovation? And the fourth webinar from our side is variables and response services, which is an innovation track, not answering any questions connected to the COVID-19 response group, but we welcome you all to sit into that session as well. Mm. So if you take the next slide, we have one additional webinar that we would like you to join. This is from a regional development perspective. It's our collaboration partner, our research institute called Nordic, who do spatial planning research, looking into what happens when we implement distance planning solutions, digital solutions in healthcare and care. How is that providing better opportunities for regional development? We know that there are approximately 130, 140 signed up for this seminar, 21st of October 2020, between 10 to 12 before lunch CET. And we have a link at this site to sign up for. So all of this will be available through our website, www.healthcareatdistance.com.
Yeah, and again, repetition here, but this is the next webinar we will have, and there will be Kristin Standal from KS in Norway and Katarzyna Wikström from Storuman, Västerbotten, Sweden, that will be head presenting here. We will host it, me and Niklas, but it will be Katarzyna and Kristin that will do the presentations. Mm-hmm. Yeah, thank you. We'll first check out if you have any more questions coming up from you. And it's a question where we're going to publish the video of this presentation, and it is on the website healthcareatdistance.com. You can see that website here where you find the publications we have mentioned, the translation of Vägkart för tjänsteinnovation, roadmap for service innovation, and also information about the webinars, and also link where you can sign in to the webinars. The first webinar now is on the 21st of October next week, the Norregio webinar. Yeah. More questions?
I think
reflections? No more questions, reflections? No.
Lisbeth, could we give the floor to you for a couple of final words from your side before we round this up?
Your mic is not on. Your mic is not off. Your mic is off. There
yes.
You go.
Sorry about that. Thank you, Lasse. Some final words from me. Is that what you were asking about?
Yeah.
Yes, I think, it's been a very interesting process until now in the project, how we have, mapped all the existing solutions that we know of in the Nordic, and now going into looking at what are being done around in the different countries, and also the way that we support these projects through the calls. And I think there's a lot of knowledge sharing opportunities across the Nordics, and I think that would be an interesting field to continue to do as much as we can. Yeah, so I think we learned a lot, and there's a lot of knowledge sharing to do. And anytime anyone wants to hear about what is going on here in Denmark, I will be happy to just reach out and we can have a talk.
Very good, Lisbeth. Some final words from our side will be that, first of all, thank you all for attending. It is our first webinar. We hope that the next one will be even more exciting when we go into other sections of the work that we have done. Of course, this first webinar has been addressing 2 of the questions that was connected to the COVID-19 response group and technology part. What eHealth solutions already exist and what should be put in place. So we have given you a few examples where we think that users should start, both from a local level, from a municipal level, as well as from a healthcare level. But we also think that we have indicated what technologies that are having the lowest threshold. Some of the technologies that are that we have presented are not that technology, from a technology point of view, that advanced. They are easy to understand, easy to grasp, easy to use. However, it is complicated to get them implemented still. And this is what we're going to speak about at our next webinar. How can the technology be brought to the people who need it, and how can we make sure that they know how to use it? So thank you very much for this webinar. Bengt, any final words from you?
Just add that what you said is a lot about culture in organizations, not so much about technology itself. And that's what we will hear more about when we listen to Katarzyna and Christine when talking about roadmap for service innovation. Okay.
Thank you very much.
Thank you. Bye.
Bye-bye.
Bye-bye.